Hi, my name is Melissa McGinnis, and I have a condition called Essential Tremor. And on January 3rd, 2025, I had a procedure called Focused Ultrasound with Insight Tech, where they went in and zapped a little area in my brain on the left hand side. And now the right hand side of my body is not shaking unless I am really tired or have had too much caffeine. Then some shaking will occur at the tips of my fingers. But other than that, then I'm really stable, which is fantastic and awesome. And then the left hand side of my body is still just shaking like it does, and that is throughout my body. So the way that my shaking was is just everywhere, internally and externally, and head, neck, legs, arms, torso, all throughout my back, which is so great. And now I can use my hand for things that you're supposed to use a hand for, and so it's fantastic and awesome. Okay, so I've been making videos about the process and some before and after videos of what I can do and cannot do and all of that. And my hair is almost grown back to a point where I can start doing something with it. Not quite yet, but probably in another couple weeks we'll be there. So that's good. I'll probably dye it soon. Just trying to decide if I want to go back blonde or if I just want to let it be kind of gray. So that's what it's doing. I don't know. Undecided. We'll see. No big deal. Anyway, I was going to do something different for this video. I am in Facebook groups where it's a bunch of people with essential tremor who they talk about things that people who don't have essential tremor don't understand because they haven't experienced it. So this here recently, somebody posted about going to see a neurologist and having a negative experience with the neurologist, which happens. I've mentioned on here that when you have essential tremor, it's not likely that you're going to run into a whole lot of people who have the condition. I, in my lifetime, have not run into 10 individuals who have the condition. I've run into that many people who know people who have had the condition or have the condition. But I probably run into 3 or 4 who actually have it. If even that, I can think of 2 actually that I remember, but probably there's been a few more. And then my dad has it. And mine and my dad's conditions are extremely opposite spectrums of how you can have the condition. There's no right way to have essential tremor. It's all over the board as far as what it's going to look like. Basically, when you go to your doctor, for anyone who does have essential tremor, you're going to be telling them what your condition looks like. And if they are telling you what essential tremor looks like, then you're at the wrong doctor. So unless you're getting diagnosed and you don't actually have essential tremor. But if you do know that you have essential tremor and you're looking for medical help for the condition that you know that you have, and they are trying to tell you about your condition, probably go somewhere else. Unless they are known to be an expert in the condition, then you're probably going to be the expert in the room. It does affect your legs, which what this post was that got me going. So a lot of times people want to come at you and tell you about yourself, especially when you have some sort of non-visible disability, or probably just anybody. I think it's anybody, but apparently it's not as much as I perceive it to be, because I get a lot more of it with having this condition, and probably being as vocal about a lot of things as I am. I get double what it is. But anyway, a lot of people like to tell you about what you have, but really you're going to be the one who's going to be doing the telling. So if this person went to go see a neurologist, a new doctor, and they had previously been experiencing hand shaking, which let's show you the hand shaking, and had recently moved into their legs, so they were seeing a doctor about that, and their doctor, this neurologist, told them, no, you don't have that. You're not having shaking in your legs. You don't know what you're having. You are not able to tell what's going on in your body. I know. You don't know what goes on with you 365 days a year, 7 days a week, all the time, 24 hours a day. No, but I do. I've just met you. I haven't even paid attention to you for the full 15 minutes that I've been in here, but I know. So those people, they don't know. Go get a second opinion. Walk out of the room. Tell them they're an idiot. I give you permission to say, Melissa McGinnis said you were an idiot. She told me. She said I should just tell you and walk out of the room. Go right on ahead. That's fine. I'm okay with that. You can direct them to this video. Unfortunately, it is just not one of those things that is fluidly understood by a lot of doctors out there at this time. And so you really do need to look for somebody who specializes in essential tremor specifically. But if your doctor is telling you, no, it is not possible that you are shaking in your legs, it is not possible that you're shaking here, there, or everywhere, then they don't know what they're talking about. Because yes, it is. It is possible that you're shaking in your legs. It is possible that you're having a tremor in your lip. It is possible that your eyelid is shaking. It is possible that you're shaking internally and externally. It's possible that you're having a tremor everywhere. It's possible that when you sit down, your tremor is not as severe as it is when you stand up, and it's just as possible that it is just as severe as when you sit down as when you stand up. So it's all over the board. It's going to be different for everyone. No one that you meet is going to have the same type of tremor, the same experience as what you have. That's just the way that it is. So your doctor, you're going to have to tell them about you. And a lot of what you're going to hear is, I don't know. And if your doctor is telling you, I don't know, as far as what it relates to your tremor, that's a much better thing to hear than, no, you don't. This is a definitive answer. That's going to be more along the lines of the things that you want to hear, because those are going to be more factual things than, no, this is what it is factually. Because those people who are telling you that, they don't know what they're talking about. Unless they're saying, no, you have ET and it can progressively get worse and it can be all over the place, blah, 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 whatever. I had to make this post because this kind of stuff, I've experienced it all of my life. It drives me bonkers and it makes me want to scream and yell at people. And sometimes I do, and sometimes I bite my tongue. Depends on the setting. And I just thought, I'm going to make a video about this because I can, and I'm making videos, so why not just throw one in? So here we go. There's the video. This doctor also said that, told this patient that they have anxiety and depression, which may or may not be true. If your doctor is telling you, if anyone is coming back at you and saying you're angry, you're upset, you're depressed, you have anxiety, you have this, you have that, whatever, there's this thing called the reinforcing nature of human interaction, and it's where they are projecting what they are seeing upon you. And so they are forcing that out of you because they are demanding that you give it to them. And you are, because you're so frustrated, you're going to give it to them. Or you're so anxiety ridden because crazy people are in your face all the time telling you about yourself, and you can't just exist. And that creates anxiety. And so they're getting what they're giving to you. And or they're making you angry, because that makes you angry when people stand in your face all the time and tell you about yourself when they have no idea what's going on, and they can't just simply ask you and say, hey, what's going on? Why do you shake? What is that? So anytime anybody asks me that, and then they're like, I'm so sorry I did that, I'm like, no, I really prefer that. That's what I like when people do, because then they're not telling me about myself when they have no freaking idea about who I am as a person. But what I do hate is when people continually stand in my face and go, let me tell you about you, person I've never seen in my life. Blah. So, anyway, nobody decides these things for you. And what I would really highly recommend you do if you're in this situation is that you spend some time understanding your emotions thoroughly and completely and psychotically, especially if you have mental health disorder issues. And because you probably do, because it's almost unavoidable, especially if you're younger, and have essential tremor. If you're older, I don't know about you guys. I've had it since I was a kid, so I just know that you're not coming out of it scot-free. If you're younger, somebody's gonna get you. Somebody's gonna get you. Something's gonna happen. It's just the way that it is. I don't know if you can get out of it unscathed when you're older. I mean, my dad seems pretty normal. Nobody's normal, okay? Everyone should go see a counselor. Everybody. Anyway, so nobody decides these things for you. Don't take it to heart when somebody that seems like they're in a position of authority is coming down on you like this. Move on to the next. There are people out there who will listen. There are people out there who know better. And there are people out there who are compassionate and have empathy for other human beings and who are actually willing to help other than hurt. This person sounds like to me, they want to be the person who's right in the room. Their reason for being a doctor is not to help other people, but to feel superior to other people. So if that was what was wanted, I'm sure that's what they left the room feeling like was accomplished. However, the patient was left devastated, obviously, and is probably in a situation where there's not a lot of support around them, or they probably wouldn't have to reach out to a Facebook group about what's going on with them. So that's horrible. And when I was growing up, there was no Facebook group. So, and when you don't have people that don't understand what you're even talking about that are around you, yeah, good luck. Good luck. Have fun with that. So doctors are supposed to do better. I don't know who this person is. I don't know who the doctor is, but human beings should be doing better. You should be helping the person standing in front of your face much better than this. That's a horrid example of humanity. So if that's your experience with the doctor, you can tell the doctor, I said they're an idiot. You can blame it on me. That's perfectly fine. I'm happy to take it. And that's all. Okay. I'm not taking any lawsuit that they think comes with that. I don't know how they could sue me for saying they're an idiot, but I suppose everybody does something stupid every day, and if they're an idiot like that, then I guess they would figure out a way. Okay, well, if you have essential tremor, good luck with your journey. Look into FUS if it's available in your area. Focused Ultrasound with Insight Tech. It's wonderful. I'm so glad that I did it. Of course, everybody's journey is different. There's all kinds of stuff out there that you can do. Explore all the options and determine what is best for you and your situation. And anybody else that's listening or watching, send this to anybody that you think would benefit from it. And thank you for watching. Click like or subscribe or whatever gets you to be notified about new videos that are coming up. I like doing this, answering or responding to things like this that make me want to yell. And so I will probably be making videos about things like that again. And then have a great rest of your week. It's Monday evening, and we're supposed to have a bunch of cold weather because that is just what's happening this winter for us. Hello, what's up with that? Okay, love you and yours. Take care of everybody in your life. Be more patient than you are, unless you're the one who's ridiculously patient, and then make the other people in your life be patient, but not figure out how to convey whatever needs to be conveyed so that they become more patient. And much love to you and yours. I think I already said that. Okay, love you. Bye.